Hey there, everybody. Thanks again for your company this morning, and shout out to all of you engaging with us. Someone here says, good morning, Joyce. The peace of God surpasses human understanding. I'm always blessed by the morning devotion, and you're tuned until the end. That's Jane Millicent watching from Muranga. I also have Eunice watching from Gilgil, who says, I really enjoy the show. It's my daily breakfast. That's great to hear. Asante Sana. Paul from Kiambu, Asante Pia for watching the show. Someone here quoted Romans chapter 15, verse 13 for us, and Isaiah chapter 26, verse 3. Santeni Sana. I really do appreciate every single one of you guys. Please keep your feedback coming into 22999. Also on social media, you can find us at Switch TV KE on Instagram, at Switch TV Kenya on Facebook and Twitter. And right now, we want to jump into our next discussion. And I'm very pleased to have this guest with us this morning. Her name is Dr. Catherine Nyongesa, and she's an oncologist and the CEO of Texas Cancer Center. Karibu sana to the show, Dr.
Thank
Great
you,
to
Joyce.
have you here this morning. Yes. And we want to talk about COVID-19 and cancer. Of course, this cancer, first of all, is a disease that has ravaged many families and homes here in Kenya to begin with. And now with this global pandemic of corona, one must can assume that the impacts are, very heavy on persons already having to deal with cancer and go through cancer treatment. But before we even jump into that directly, let's talk about some of the different misconceptions there are about cancer in Kenya. I think for a very long time, it's remained a disease that a lot of people have not understood, and have just not been able to find the right information about. Would you agree with that?
True. Yeah. First, I would like to appreciate for you giving me this opportunity to share. And I really enjoy your show, and I follow you. I'm a big fan of yours on social media. You'll be surprised. Thank you for the ministry.
Amen.
So cancer is a big problem in Kenya. It's the third leading cause of death in our country. The top one is infectious diseases, followed by cardiovascular diseases. Then cancer is number 3. There are a lot of misconceptions about cancer. Number one, people think that cancer is a death sentence. They actually fear going to hospital to be known they have cancer. And some have a misconception, which is not true, that operation spreads cancer or surgery spreads cancer. And some believe that cancer is a curse. But all those are misconceptions, because cancer is just a disease that can strike anyone. And it has most of the time the causes are not known, but there are a few risk factors like use of tobacco, alcohol, growing older, and maybe I would like to say that when cancer is diagnosed early, it is not a death sentence.
Right. So very important, and for us to really change those perceptions, right? And so cancer, of course, being number 3 here in Kenya as far as one of the top diseases ailing our people. Are there specific cancers that are especially prevalent here in Kenya?
Yes. When we look at the global cancer statistics that were released in 2018 by WHO, we find that in Kenya, the top cancer, especially in women, is breast and cervical cancer. In men, we have prostate and throat cancer. In children, we are dealing more with the blood cancers, kidney cancers, and maybe eye tumors and brain tumors.
For children's cancer, I mean, kidney cancer, I mean, it just seems so aggressive for a little child. Is that linked to any sort of genetic imbalance or anything, or genetic history? Kidney cancer for a child?
Yeah. Fortunately, childhood cancers, if picked early, are more curable than adult cancers. And there are many children who've had kidney cancer and they have survived and they're living well. One of the risk factors, it could be genetic. Other times it's unknown what brings on this kind of cancer in children. And then maybe just to emphasize that in Kenya we see about 47,000 new cancer cases every year in adults, but children there are about 3,000.
Okay.
So fortunately, cancer is less common, or it's reported less in children.
All right. And it's good at least that there's data backing up the number of people that currently do go and get tested, or at least checked up, and find then that they're struggling with one form or another of cancer. But I think part of the biggest challenge, maybe you'd agree with this, is just because of those misconceptions, many more people, we just don't know, we don't have enough information, because many more people are not going to find the right sort of treatment, and discovering it at an early stage. So of the 47,000 plus cases that are discovered in this country, are you able to estimate if most of them are sort of discovered far later in the stages of cancer, or are these sort of early detected cases?
There was just a pilot study which was done, and it shows that in Kenya, about 60 to 70% of the cases are presenting late. This is because there's a lot of barriers of people seeking healthcare in a timely manner. Number one, cancer is a strange disease. The symptoms and signs resemble those of common ailments like infections, you know. So by the time somebody is confirmed with cancer, they have gone through unnecessary treatments before they are actually diagnosed. So the government has put up what we call the National Cancer Screening Guidelines, just to which one can find online. You can log in to see what are the common cancer symptoms, especially for the most common cancers. When can you go for screening?
Right.
Because when you go for screening and early diagnosis, the cancer is going to be picked up in very early stage, and the cure rate increases.
Right.
When we look at the 47,000 new cancer cases, we lose about 33,000 every year. So this is a bit sad.
Yeah.
And that's why, as a community, as a population in Kenya, we need to be aware of the common symptoms of cancer. So when you have cancer, you go to hospital early.
That's a huge number of people that we're losing each year. But you know, sisi wa Kenya yenyewe tunaogopa madaktari. I don't know why, but we are really scared of doctors. And I speak as one of them who's really afraid of doctors.
True.
I respect them, but I just, they're not my best friends.
Yeah, no one likes hospitals.
Nobody likes hospitals.
Yeah, even a small child.
Yeah.
Say, no.
So even as far as early detection then, at what stage, you know, when should one say, okay, by the way, I need to go and get this tested out? Is it when you have a cough, you should go to the doctor? Because we're very good at self-medicating. We go to the counter and we just know which dawas worked for our friend. Huyo mwingine akasema, hiyo sasa hiyo ndio poa kabisa, hiyo ndio itakusaidia teke. So, is it that we should just sort of instill this practice of always going to a doctor, or is there sort of a guideline or a timeline, like if you've had an issue persist for even 2 weeks, maybe you need to go and check that out rather than trying to do all this self-medicating?
I think as Kenyans tunapenda kuvumilia. You vumilia a lot. If something is not paining,
yeah,
or you are not bleeding, I won't go to hospital. Because many a times I go to the village, then somebody, I've had this swelling for months, but you know it doesn't pain, so I've not gone to hospital.
Yeah.
So the thing is, we need to move out of the culture of vumiliaring and try to find out what is this that is ailing me. And most of the time, the symptoms and signs we have are really not maybe geared towards cancer.
Right.
It's on rare occasion that it could be cancer. So when you are being treated for simple ailments and the symptoms are persisting, then ask your doctor, what is this? Because I've been treated for malaria, typhoid, ulcers, I'm losing weight and everything, but I'm not getting better. So at that point in time, you need to seek a second opinion.
Okay.
Secondly, we have what we have said, the National Cancer Screening Guidelines. Actually, the government has outlined which cancers and what age group should you go for screening. So you can try out that.
Okay.
And also look at, now with COVID-19, we know that people who have comorbid conditions like high blood pressure, heart disease, and chronic lung disease are very much prone and elderly. So when you should also be checked for this, because hypertension is a silent killer and it kills more people in Kenya than cancer.
Right.
So those are things we need to start seeking a better health seeking behavior.
Right.
And once you hit 40, maybe once in your birthday, you can say, I'll go for medical checkup.
Right.
Just
Gift
go
it
once.
as a gift to yourself.
Yes.
Yeah. Take care of yourself.
The way you take your car for service, why not take your body? You know, after some time, our bodies need to be seen by the doctor just to make sure everything, the nuts, the loose nuts are tightened.
Right.
Any bad area is fixed.
Yeah.
So it's good to have at least once in a year if you can. And then with the time when the doctor says you are healthy, then the visits can be less frequent.
Okay. All right. Wow. Well, I think this is a good point for us to take a break. And when we come back, we now want to focus in specifically on COVID-19 and cancer. But I think it will also be an opportunity for us to get to meet Dr. just a little bit and even just hear about the Texas Cancer Center, which of course she leads. 22999 is the SMS line. Please send us your feedback and we'll be back at the top of the hour. Hey there everybody, my name is Joyce Omondiwa Higa and this is Full Circle with Joyce. Karibuni sana to the second hour of our show. Certainly hope that you're blessed this morning by what we're bringing for you. And asanteni sana to those of you who've been engaging with us. I see Carol from Kabati here saying tuned in to learn about cancer and gain more knowledge. Asanteni sana for the show. Eunice from Gilgil as well. I think I'd read that one earlier. Asante sana for your feedback as well. I'm going to be reintroducing our guest here shortly. We were just chatting with her in the previous hour. But before I do, let me share with you our quote for the day. It's by Nelson Mandela. And it says, "For to be free is not merely to cast off one's chains, but to live in a way that respects and enhances the freedom of others." Wow. Okay. For to be free is not merely to cast off one's chains, but to live in a way that respects and enhances the freedom of others. I think this is such a profound statement from a man like him who spent that long in prison. You know, there's a way that I feel like if we were in his situation, you know, would we just have thought about our own freedom and called it a day? But here he was saying that freedom is not just for yourself, but to also do it in a way that provides it for other people. That is absolutely profound, especially considering all that he went through. What an example that we have, you know, even just to follow, of a person who is very selfless, really, and just that humility to put other people before himself. Lots of great respect there for Nelson Mandela. And lots of respect as well for our guest. Her name is Dr. Catherine Nyongesa. I'm so excited because A, she said she's a fan of Full Circle with Joyce. She actually watches the show and she follows me on Facebook.
Yeah.
She's been telling me details of my posts and I'm just like... Karibu sana to the show, Dr. Good to have you. Yani, thank you so much for making the time and more so for watching the show. Do you have a favorite segment, by the way?
Yeah, but the full circle.
The full circle. Yeah. I like it. I like it.
Yeah.
All right. Well, we're here talking about cancer and COVID. And we've talked a bit about the different misconceptions there are about cancer in Kenya, what the different what the most prevalent sort of forms are for both men and women. And I'll want us to dive deeper into relating that now to COVID and the times that we're currently living in. But before we do, I think it's important for us just to understand sort of the motivation behind you setting up the Texas Cancer Center.
Number one was, I think, sometimes some things are beyond you. It's God's direction. Though I would say on top of that, I've had very close members of my family with cancer. One of them was my sister, who has fully recovered up to now. And then my brother-in-law, my sister-in-law, my father-in-law. So cancer is like close to me, and I felt as a doctor I need to do something for the patients, and just bridge the gap, because I realized there was a lot of difficulties for cancer patients accessing timely health care for
Right.
the treatment of their cancer.
Right.
There were long waiting queues, and even me, when I was taking my sister to hospital as a medical student, I struggled a lot to find an oncologist, to get chemotherapy for her. So because of that, I said, why not? And we partnered with my husband, and the rest was history. And we thank God, despite the challenges, how far we've gone. It's not been an easy journey,
Right.
but we are grateful for the people's lives that we've changed in a positive way. Though we know there are some who have lost their lives because the cancer sometimes is very aggressive, but there are those who have benefited, and we just keep praying that God grants us more strength and we walk the journey.
Right.
Yeah.
Yeah, and there's still certainly a lot of work to be done. One of the most heartbreaking stories on media sometimes is when we hear about, in our public hospitals, how, machines are broken down, or there's only one machine and people are waiting in these tremendous queues, for treatment, or even the cost of that treatment is really unbearable for Wananchi. And I'm sure cases like those must frustrate you as well. And just before we dive back into COVID and cancer, I don't know if you have any sort of pointers, or what are some of the things that you would like to see really as far as general treatment care options are for cancer here in the country, considering the bulk of our population cannot afford to fly out to other countries or seek very expensive medical options?
One is just to make it affordable and accessible, the way our government did for HIV. Like, no patient will travel from Kisumu, for example, to come to Nairobi for HIV treatment. So it should be the same. Like, we strengthen the county governments to be able to offer these services to the people.
Okay.
Yeah.
All right.
Number one, to make it affordable for insurances like NHIF, maybe to offer them a little bit more. But I know they have done a big job by just supporting the cancer patients.
Yeah.
Yeah.
Okay. So in terms of the season that we're in, of course, you mentioned earlier that patients with, say, hypertension, high blood pressure, diabetes are especially vulnerable to COVID-19. How does that then relate to patients who maybe already have cancer and are already dealing with that? What is sort of the risk factor for them with COVID-19?
So cancer patients have a suppressed immunity because of the cancer itself, and cancer being a chronic disease, they're more vulnerable to getting COVID-19. And worse off if they have other comorbidities like high blood pressure, heart diseases, and maybe lung disease. Fortunately, I think God is great. Like at Texas Cancer, I've not seen a cancer patient coming with COVID.
Wow.
Even in Kenyatta Hospital, the cancer center I work in, we have not reported a case of cancer and COVID. So God has been faithful, and we hope the status remain cool so they don't get this COVID-19.
Yeah.
But patients were also shaken. Cancer patients were also shaken and affected by this COVID-19.
Sure.
One, the curfew and the lockdown. When Nairobi County went on a lockdown, many of the patients travel from outside Nairobi. So they fear coming to Nairobi, and some of them even tried coming and they were stopped. Some of their relatives, maybe they had admitted the patient in Nairobi and went back to the village. They could not come back to check on them and support them. So that was a big problem. Another issue is some of them stay in hostels or hotels, which were closed because cancer treatment will take a longer time, like a month you're coming for radiotherapy. So you could go stay in a hotel, in a hostel, and with that closure, they were affected. Transportation was a problem. Many people lost their jobs, and these patients were staying with relatives, so they could not afford any longer to stay with them and support them. And then the curfew hours, some of them were getting radiotherapy or chemotherapy, so they fear they'll come to hospital and maybe they may not get treatment in time to go back before the curfew hours. So all those things have been
a lot of different
playing.
nuances.
Yeah.
Yeah, absolutely.
Yeah.
And as you're saying that, then of course there are also those who are even more scared about going to hospital and getting screened and getting, you know, their treatments. Is there a way for, is that something you'd encourage, first of all, even just sort of staying away from these medical facilities where of course the risk factor is elevated, or is there a way for them to pursue some sort of treatment options at home, or a combination of both, let's say?
I think now with the telemedicine, there's a lot of encouragement that the patients reduce hospital visits, which are not very necessary. Like if you're going to collect your pain medication, you can collect from the county. Simple treatments like for managing symptoms associated with cancer, you can be managed from the nearby county hospital. But when you need specialized treatment, fortunate enough, Texas Cancer Center, Kenyatta National Hospital, and other cancer centers in the country did not shut their doors to cancer patients. Even the president announced that cancer patients should continue receiving care. And that was a good thing. At least they managed to get their treatment despite all these problems.
Yeah.
But if you have symptoms that are persisting, don't shy away from going to hospital and being screened, because cancer is still also a deadly disease, and we don't want you to have delayed diagnosis or going to hospital when it is a bit too late.
Right. So there's not necessarily anything new that cancer patients would need to know about coronavirus, but to just be extra careful, really.
Definitely, the best way to prevent corona is to be aware of this disease. What is coronavirus disease? We know it is a viral disease that is transmitted through coughing, sneezing. So people need to be aware of that, even if you are a cancer patient. And then how do you protect yourself? By social distancing, like the way we are doing now.
Yeah.
Wearing a mask when necessary, especially in public places. Hygiene, washing your hands. If you don't have a sanitizer, you can wash your hands with soap, and just keeping yourself clean.
Yeah.
Trying to eat a balanced diet so you are healthy. Be checked for other comorbidities like high blood pressure. Let your doctor check you for heart disease, because those ones will also put you at a higher risk. We've also seen that coronavirus disease attacks, it's more severe in the elderly people. So when you are up in age, you also need to be more careful about your health.
Right.
And when you are younger also, you need to be careful, because you can still contract coronavirus disease. We've seen it attacking children, young adults, and even elderly people. Fortunate enough, in our country, most of the coronavirus infections are asymptomatic. So people are asymptomatic, they don't necessarily need even treatment in hospital, and they recover by themselves. Coronavirus disease up to now has no definitive treatment.
Right.
It is more of supportive care. There's a lot of research that is going on into getting vaccines, getting medications that can treat. So the best way is for you to try to prevent by social distancing, washing hands, wearing masks whenever it is necessary.
Right. And you talked earlier about, by the grace of God, that no one at Texas Cancer Center or at Kenyatta where you work, any cancer patients there having had contracted coronavirus. For those though who are asking, can someone survive that if they're already a cancer patient?
Yes, they can survive. It just depends on the severity of the coronavirus disease. As I said, majority of the Kenyan coronavirus disease infection, they are not symptomatic, and most of the patients recover without even treatment. But obviously, if they have those comorbidities, or they are up in age, or they have a heart problem, they may get a severer form.
Right.
There's always hope. I
Yeah.
think just with any other infection, there's always hope, and one is just to seek treatment.
Right.
I've seen cancer patients, especially when they have chest symptoms, maybe the cancer has gone to the lung, or they have cancer of the lung, they are coughing, they get scared of going to hospital because they'll be labeled as probably coronavirus. Yeah, but somebody cannot just look at the symptoms and tell you have corona.
Right.
It is until you are tested. Yeah.
Very interesting. And I wonder then too, of course, we've talked about screening and early detection, you know, being very key in as far as being able to be treated well, to be able to overcome cancer. Is screening, though, a priority? Would you say it's still a priority in this season, considering they're also saying don't make these hospital visits unless you absolutely have to? Would you consider, you know, just, you know, any one of us, the way we're doing those medical checkups, going to do a screening at this point in time? Or would you advise people sort of wait it out for maybe the next 2 months or so?
Okay, there's a lot of development, and it's a learning curve about how do we handle these other illnesses with coronavirus. What I would suggest is that screening is not an emergency. So it's something you can schedule with your doctor. So you don't go and wait in the queue. You go at a specific time, they have booked you, you get in, the doctor checks you, and you go home without joining a big crowd. Because it's only maybe emergencies that you need to go to hospital as soon as possible.
Yeah.
Yeah.
Yeah, absolutely. Wow. Dr. Nyongesa, there's some feedback here for you. Lady Rose from Embakasi saying, good morning, I'm loving the show and learning more about COVID-19 and cancer from the conversation. Ima is a pharmacist, and they've heard you talk about this, and they're amazed that you've spoken about the barriers that bar Kenyans, especially low-income earners, from accessing healthcare and therefore late diagnosis of chronic diseases. So from a policy level, that's something that certainly needs to be prioritized. Ferdinand Wangila says, thanks, Joyce, for bringing Dr. Nyongesa on your show. We, the people of Mayanja, Bungoma County, I'm very much proud of her. God bless her. She continues providing medication to cancer patients. Hey, what wa Bungoma lasema?
Bungoma, salamu mpaka zifike.
Sijui kama uko na salamu.
Hata mimi nataka kusalimia watu wangu wa Bungoma, wazazi wangu, baba yangu Nyongesa, na mandugu zangu, na mafansi wangu wote, na mafansi wa Switch TV. Na hata Naitiri penye ninaishi kwa mzee wangu nilipata kuna mafansi huko pia, ninatuma salamu zangu. Thank you so much.
Daktari, asante sana for being here today.
Okay.
It's been such a pleasure talking to you. Thank you for making the time and just shedding some more light on this topic for us. Again, cancer is not a death sentence. The important thing is for us to go out and get treatment early, to get screened early, because this is something that is absolutely preventable. And more so to the policymakers as well, we want to hear more discussions of how we're actually taking this out to many of the populations in this country who cannot afford treatment. So thank you once again for shedding light on this.